Hello, and thank you for being here today. I would like to introduce Linda Polhammer, a patient affairs liaison with Pfizer, for an insurance review today.
Hi.
Linda.
Hi. As Jill just mentioned, I am a patient affairs liaison with Pfizer. And what that means is I'm field-based, non-medical, non-promotional, and non-sales. So I don't give medical advice. That's not my job. My job is to talk to you about Pfizer resources. And what we'll do is kind of talk a little bit about that later on. So what I will also want to tell you is there's 10 patient affairs liaisons with Pfizer. And that's what I want to talk to you about the end, is to talk to you if you're interested in how to get in contact with the patient affairs liaison in your area. So for me, I've been involved with the rare disease community for about 35 years. Been very pleased to know and work with Jill for over the past, I think, 5 years. And Jill selected this insurance review for us to review. So it is a high level basic understanding of health plans. So let's get started. So as I said, this is an insurance review to look at the basics in understanding healthcare plans. So this is a promotional speaker program sponsored by Pfizer, and I am a Pfizer employee. This presentation is not intended to address or be a forum for discussion about products or treatment plans. Please refrain from discussing your treatment discussions during this program, and health insurance certainly can be confusing. So it's a complex topic, many variables to help you understand your options and learn about coverage that may be appropriate for you. The information in this presentation is provided as an overview for some health insurance basics and may be helpful to know, especially definitions. So any questions about individual treatment should be directed to your healthcare provider. So this is what we're going to try to touch on with this presentation. Understand the difference between the characteristics of insurance plans. Gain a better understanding and working knowledge of some commonly used insurance vocabulary. Learn about the types of health insurance. Learn about the reimbursement journey that you go through. Review questions to ask of your insurance provider. And I think that's really important, the things to consider when choosing a healthcare plan, because it is your choice. So learn about hubs and specialty pharmacies and consider resources that you might need to look at later on. So as I said, expectation, this presentation is a high-level overview of insurance basics to inform information about some things that you may want to consider as a person being treated with a specialty medication, as with acromegaly. So this presentation, is not a detailed look at elements of insurance, nor is it recommendations for treatment or healthcare plan treatments. So really importantly, connect with your healthcare provider or insurance provider for specifics about your healthcare coverage. They're the people to talk about those specifics. Okay. So glossary. So what we're going to do is the topic of insurance has many terms that may be unfamiliar to some people. We've included some glossary definitions throughout this presentation to explain what some of these terms mean. Knowledge of insurance terminology certainly can be helpful when reviewing your existing or future coverage and understanding communications about your insurance plan. So in this presentation, the glossary words kind of appear in italics and they're in orange. So here's an example. So deductible, that's kind of a common term. The amount you pay for coverage healthcare services before your insurance plan starts to pay, okay? That's a basic one, and everybody's probably heard that one. So what are the types of insurance? So the types of insurance, we're going to go over 3. There are many types of healthcare insurance. Here we will discuss like the 3 common ones. So commercial health insurance plans. They're the insurance plans not administered by the government, and that's a key point. You may receive commercial insurance through your employer, your spouse's employer, part of a family plan if you qualify. You can also purchase health insurance directly from an insurance carrier through the federal marketplace. or actually through an insurance broker. So that is the definition of a commercial plan. So then we have Medicaid. Okay, this Medicaid provides healthcare coverage to eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. That's Medicaid. So then we have Medicare. So Medicare is the federal health insurance program for people who are 65 or older, certain young people with disabilities, and we'll go over that a little bit more, and people with permanent kidney failure. Okay, so okay so far?
Yes.
My pace is okay?
Mhm.
Okay, many beneficiaries. This is overview of a commercial healthcare plans. First of all, many beneficiaries or people covered by insurance choose commercial health insurance plan through their employers, and it is often partially paid for or subsidized by your employer. So you're paying a part, and your employer is paying a part of that. So you're not paying everything for your insurance plan if you get it through a commercial provider. Okay. So employers offer specific benefit options that have already been negotiated and decided upon insurance providers or payers. Okay, so that's when in a commercial plan, you get your different levels, gold, green, whatever, and you actually go in and look at the details and pick the insurance coverage that best meets your needs. Okay, so pharmacy benefit, and this is something specific that you need to understand. So pharmacy benefits or coverage for prescription is provided or carved out, if you will, and sometimes contracted out to, and I know you've heard this, pharmacy benefit manager or PBMs. So what PBMs are companies that manage prescription drug benefits on behalf of payers. So they actually do that negotiation on the behalf of your insurance provider. Okay. So they process claims and handle the administration function involved with prescription drug programs, okay? And they develop and maintain a program drug formulary. And what a drug formulary is I like to think of it as a book of all the medications that they've decided to provide. And it's just all the medications in there, or if yours is in there, then that's in the formulary. Does that make sense, right? So employers often share the cost by contributing through. Now, payroll deductions, once again, remember we said that you don't pay for all of it if it's a commercial plan. So it's payroll deductions or deductibles, the amount you pay for your covered healthcare services before the insurance starts. So that's the amount of money that you'll see that you need to pay before your insurance kicks in. And then you have co-pays. That's a fixed amount that you pay for coverage for a covered healthcare services after you've paid your deductible. So that's your co-pay agreement. That's part of your insurance plan. So co-insurance is a percentage of the cost of coverage healthcare services you pay once again, after you've paid your deductible. And that's also negotiated by your healthcare plan, okay? So let's talk about overview of Medicaid so that you have a good understanding about that. So advocacy groups, why I can't say that sometimes, I don't know. Groups can help provide, can I try that again? Mm-hmm. Advocacy groups can help provide more detailed information to state-specific rules. So this is kind of an overview, but your specific state has different rules and regulations and I don't know, just how they distribute that. So check with your advocacy leaders to learn more. So Medicaid, remember, all states and the District of Columbia and the United States territories have Medicaid programs designed to provide health coverage for low-income people, okay? So Medicaid, together with Children's Health Insurance Program, or you might know it as CHIP, provides health coverage for over 72.5 million Americans. So Medicaid is the single largest source of healthcare coverage in the United States. So jointly run. So that's why I said you have to understand your particular state, because it's jointly run by the federal government and your state and local governments. Okay. So beneficiaries and eligibility. So beneficiaries fall into 4 major groups. So infant and child, pregnant women, parents and other non-elderly adults, seniors, individuals of all ages with disabilities. Okay, Medicaid is an entitlement program. So anyone who meets the eligibility rules can enroll for coverage. Children, like I said, in the CHIP program, account for 43% of beneficiaries. So most Medicaid eligibility is determined by income status. Once again, program eligibilities vary by state. I can't say that enough. Please refer to www.medicaid.gov to learn more if you're interested. So let's take a breath and talk about Medicare overview. So once again, the site is visit www.medicare.gov for more information. So these are just Medicare basics, just to get you started. The difference in the parts of Medicare help coverage specific services. So Medicare A is your hospital. That's your basic program. Medicare B is your medical insurance. And Medicare D, which is a little bit younger than or newly added, is your prescription drug plan. Okay, so health and prescription coverage. So once enrolled, there are 2 main ways to get Medicare coverage. So the original, like I said, the original Medicare includes Medicare A and Medicare B. If you want drug coverage, you can add a separate Medicare Part D program. Okay. So, and you'll hear this when they're talking about Medicare Advantage plans. This is an all-in-one alternative original Medicare. So these are bundled. So you can get Medicare A, Medicare B, and usually Part D. Okay. To be a little bit more specific, Medicare Part D drug coverage, Medicare drug coverage helps to pay for prescription drugs. To get Medicare drug coverage, you must, underline, join a Medicare provided plan that offers drug coverage. These plans have different monthly premiums. How much you pay for each medication or drug depends on which plan you choose. You know, just very similarly to when we talked about commercial plans, you have to go through that menu to pick what's appropriate for you. You'd need to do the same thing here. Okay, so out-of-pocket costs can vary based on the type of insurance. So, and the formulary. Remember, we talked about the formulary being that book that the insurance plan decided these are the medications we think we're going to cover. So out-of-pocket costs are your expense for medical care and aren't reimbursed by insurance. So that you actually take out of your pocket, and that costs include deductibles, co-insurance, co-pays, or covered services, plus all the costs for services that aren't covered. So remember, all that out of pocket is things that we talked about before. Just to repeat, that's your deductible, your co-insurance, your co-pay, and anything covered, anything that's not covered under your insurance plan. So that's why you need to understand what's covered and what's not covered. So a formulary, once again, I know I'm repeating myself, but is a list of prescription drugs covered by a prescription drug plan or other insurance plan offering prescription drug benefits. Okay, so that's the cost sharing depending on the plan and benefit design, as do premiums and deductibles. So those are, no matter what insurance that you pay, the commercial or the Medicare, you need to understand these out-of-pocket costs. So across insurance types and the reimbursement journey. So insurance pharmacy benefit cards, some commercial plans will issue both cards. Like one is your insurance or medication card, medical card, and then the other might be a prescription card. So you get two cards with a commercial plan. So examples of patient cost sharing. Premiums, we talked about the amount you pay for your health insurance every month, deductibles, formulary benefit design, and copay or co-insurance. And that's a repeat, but it's just worth repeating. So, and you may have heard of this, the most plans have what they call a tier program, formulary tiers. Remember that book of medications? But the tier program is what has these medications, how they fall, and how much you're going to pay that out of pocket. So specialty medications used to treat rare, chronic, or complex conditions. You can see by the 1, 2, 3, 4 dollar signs, these are the most expensive. These are the rare disease medications that you can expect are going to cost a little bit more. So tier 3 is non-preferred medications. These are brand name medications that are not included on plans or formularies. So they cost a little bit less, but they're still expensive medications, okay? So tier 2 is really the preferred. These are the brand name drugs that are listed in the plan's formulary. That's that thing that we talked about, that book, the formulary medication, that list is in there, that costs a little bit less. And then we go all the way down to tier 1. And I know you've all heard about generic medications. These are prescription drugs that have the same active ingredients as a brand name, but cost a little less. Uh-oh. Shoot. What? I'm on my call. Oh, sugar. Okay, Jill, I'm sorry. Can we take that out? I can't get my slides to advance. Sugar. Oh, sugar. Why isn't it going?
So neither
Lord.
one of your buttons, even on your...
None of my buttons are working. Oh, wow. That's never happened before. Uh-oh. Okay, now let's, okay. So beyond cost sharing, can you cut that all out? Thank you, dear. Beyond cost sharing, payers often use management tools for drugs. So medications for acromegaly are often classified as an orphan drug and tiered specific as a specialty drug. Orphan drugs are those defined as those intended for treatment, prevention, or diagnosis of a rare disease or condition, which is one that is affected fewer than 200,000 persons in the United States, or meets certain cost recovery provisions, okay? So prior authorization, what does that mean? You all possibly have heard of this. So prior authorization is approval. When you have these orphan drugs, you will expect to hear the word prior authorization, is approval for health plan that may be required in order for the service or prescription to be covered by your plan. So in other words, it has to be checked with your insurance before the insurance will give you that medication. Don't know if you've heard of this, but there's also what they call step edit. Step edits are policies that require patients to try preferred drugs before non-preferred drugs are approved for reimbursement. Sometimes that's called fail first policy. Okay. Reimbursement process, and here's the road that you guys have probably experienced. Here are some of the key events that can be expected as part of the process of accessing specialty medications. Okay, so first you go to your physician and you get your specialty medication. Okay, so benefits are verified. So you have your insurance, it's active, it's all good to go. And then what you would need is a prior authorization submission. And that might be the step therapy and authorization and prior, and these policies may be required for patients with therapies, you know, in a particular order. Or they need to understand why you need the medication that you're on. So they may ask for more information from your healthcare provider to make that work. So then after they've got all that in one bundle, then the insurance makes a decision. Once the insurance makes a decision that you can have that medication, then you get your medication. Okay, so we don't finish here. We get to redo all this next year. So your insurance coverage will turn around and look at that, all that information that was provided next year, and decide whether or not we need to review this process or possibly stay on this medication for another year. So what to consider when choosing a healthcare plan. So things you want to consider. So choosing a healthcare plan, and I think we've kind of touched on this a little bit. I think it's important to educate yourself on insurance terminology, which we've gone over a couple. Understand the insurance changes at key life stages. What is going on in your life? What changes have happened in the last year that when you go to pick insurance, you need to pick something specific to meet your needs. You know, your life doesn't stay the same year after year after year. So how can we best cover yourself, your family, you know, et cetera? And what can I pick and how do I need to take time to look at that? So evaluating your insurance plan, cost, benefits, and choice. Remember, I said, you'll get that list and you need to see what best meets your needs. So this is a great list. This is questions you can ask when choosing a healthcare plan. What type of plan is it? What is the premium or plan? So premium is the amount, remember, the amount that you pay for insurance monthly or annually. And remember, if private insurance or commercial insurance, you're not paying that total. So what your premium is what you're going to be paid either monthly or annually. So what out-of-pocket costs am I responsibility? You need to know that. You need to understand that. You don't want to be surprised when you go to a doctor's visit and find out, you know, that you have a copay. So does the plan cover the services you need? This is an important one. What do you do? What do you need that you need to make sure is covered? And again, you don't want to be surprised. Are my physicians in my network? So in network and out of network, you need to also understand. Out of network means the doctor or physician does not have a contract with your healthcare provider. So before you select that insurance, if your doctor is important to you, and I would imagine, you know, with a chronic illness, that's something that you want to make sure your doctor is in the plan that you're about to select. Are referrals required? So if I need to go see a specialist, how do I do that? And if so, which services need that referral? Is it a scan? Is it a treatment? What is it? You need to know what those services are. Am I covered? Here's a good one. Am I covered if I get sick and need treatment when I'm out of state? You know, you need to ask those questions. Are laboratory tests and services included in my plan? And oh, by the way, which lab is included? Because they may have been selected for you as well. And is there a lifetime or yearly limit or cap? So limit or cap just simply means the maximum benefit paid by my insurer. Some insurance companies may have caps or certain cost, you know, limits. So let's see, where were we? What are the plans, exclusions or limitations? Are there any exclusions? Like, can you have physical therapy, healthcare services, home care services? What is not included in what you're paying? So look, once again, I guess back a couple slides, look at what's going on in your life and what you need covered, and make that insurance coverage specific to you. Additional questions that you might want to keep in mind. Plan details. Is the purpose treatment covered under the major medical or pharmacy? Remember, if you're getting a prescription, is it under your major medical or has it been carved out as a pharmacy benefit? You probably may have heard that, but that's something that you need to make sure of. Do I have a choice in a specialty pharmacy or has that been selected for me? And you should know that when you start your journey. Do I need a referral for certain specialists? If I have to go to a special doctor, XYZ, for anything outside of possibly my initial diagnosis, do I need a referral? And how does that work? What do I do? What paperwork do I need? To have an understanding, because you don't want to be surprised. Coverage for services and devices. What services, like I said, what services might require prior authorization? You know, like physical therapy covered, or home care services covered if you need that, or durable medical equipment. And that means like beds or, you know, just things that could be provided in your home if you decide that you think you need a hospital bed, or somebody in your family in a family plan needs a hospital bed. Is that covered? You don't want to be surprised by that. So you do have to educate yourself to know also what questions to ask. So hubs and specialty pharmacies. So hubs, if you've heard that term, hubs are offering included programs and options for patients, which may include help with benefits, investigation, verification, that prior authorization, drug delivery, administration, copay support, financial assistance, and even some patient education. So hubs exist to help the patient access and afford their prescription medications. So you need to understand if you have one of those accessible to you. These can be helpful for specialty, remember those orphan products, since these patients may need to maintain contact for several different reasons. They might need entities like doctor's office, insurance companies, pharmacies, and advocacy groups. So this hub will have that information for you. So you need to know if you have access to that or be aware. So a specialty pharmacy. Okay, a specialty pharmacy distributes specialty medications, which may include medications that treat complex, chronic, and or, much like the acromegaly community, rare conditions, because they're high cost medications. They're medications that are not available through exclusive, restricted, or limited distribution. So in other words, you know, not every pharmacy just has your medication on their shelf. So it has to come through somebody that has that distribution ability and can supply that medication to you. Medications require special storage, handling, administration, and that's why those specialty pharmacies are out there and were created for these kind of medications. Medications that require also, like, because you'll be within your pharmacy, so these medications require ongoing monitoring for safety and or efficacy, typically provide more support than a retail pharmacy. So remember that these medications, these specialty medications, aren't on your corner drugstore shelf because of the things that I just mentioned. Oops. Oh, shoot. Sorry, we're going to have to edit that too. I'm sorry. My resources and conclusions. So here's some online resources. Finding Health Insurance, www.usa.gov, Finding Health Insurance. Medicaid main site, we went over that, www.medicaid.gov. The Healthcare Exchange is, again, www.healthcare.gov. Centers for Medical and Medicare and Medicaid Services, and I'm not going to say those out loud, and get in touch with your patient affairs liaison. Now, this has changed now to getting in touch with your patient affairs liaison in your area, because I don't know if I mentioned, but there are 10 patient affairs liaisons throughout the country, and you may have one in your specific area that you might want to reach out to. To do that now is been changed to www.togetherforrare.com. And we're going to make sure Jill has that information too for you. So please make sure you check out the flyers and reviews, insurance definition, and suggest any questions about your healthcare plan featured in this presentation. So in summary, there are different options for getting insurance coverage, such as commercial and government. Understanding insurance terminology can be helpful in interpreting your plans. There are questions you can ask to help ensure your plan is the right one to fit you, your family. We've talked about that a couple times. Very important. There are questions you can ask to help ensure your plan is the right fit for you. Remember all those questions and all that information we went through. It is important to stay up to date with information on your plan, what's going on with you, and how you can best make that fit. Programs are available to offer resources that can help with insurance, access to medication, education, training, and support. So this concludes my presentation. So I just want to thank you and Jill for attending, and I look forward to maybe talk to you in the future. So thank you very much. And I enjoyed talking with you.
Thank you so much, Linda. It's been a pleasure. And for those that are still with us, please stay on, and we will bring on an expert to discuss if you have any questions. Thank you.
Thank you.
There we go.
So can we edit?
Yes. Yeah.